Good morning, everybody. I think we're live streamed. I'm trying to get everything kind of synchronized and going. This morning, we have a special guest, Margo Wickersham from Exp Agent Healthcare by Clearwater. She's one of their lead representatives. We're so excited to have her on the huddle today and talk about the benefits of Exp Healthcare. Welcome, Margo.
So great to be here. Thank you for having me.
Before we get started, tell our audience a little bit about what you do for Exp Agent Healthcare and how they can contact you and so forth.
Right. I head up the partnership between Clearwater and Exp. We worked directly with Mike Vane and Glenn Sanford 2 years ago to pioneer bringing amazing healthcare to agents. Back when it was a little old company of 22,000 agents.
That's right.
Way back in the past. And so we've worked together with the growing team and the team leaders to develop the best ways to provide healthcare to agents. We've added plans. We always innovate. We're always adding options and plans, constantly improving. So what we do is work closely with leadership and team leads and also agents to develop and deliver the best possible options and care that we can. We're not perfect, but we constantly strive to get better, and we love what we do. I've got a team of consultants who are all licensed in all 50 states. They're true consultants and they're amazing, and I have so much respect for them. And we provide an amazing service of helping people navigate what options to consider as they're looking for healthcare plans. And we'll even tell them when we talk to agents, if they're on a plan that's best for them, we'll just say, stay right there. You're on the best thing for you. So we love helping.
I've heard that.
Yeah, good.
Yeah, I've heard that, and that's awesome. You know that you're trying to find the best plan for you and your family. And to have someone that's going to be truthful about that is extremely important. Just kind of, so what are some of the ways that like the agents are saving money? Why should they kind of come and do a consult with you guys? And what are some of the different, why is it better than a lot of programs out there?
Right. That's a really good question. And I think I'll start with what's the landscape like out there for Exp agents. About a third of agents have a plan through the healthcare exchange, or they're just individually buying it. Those are usually really expensive. We can typically save those people a lot of money, typically. Another about third of agents have plans through a spouse who has a job, or maybe they have a part-time job. We know of a lot of people working at Costco or Starbucks just to get benefits, which is, unfortunate. And we can help offload that need for a part-time job and save them a lot of money. Then about another third are completely uninsured altogether. And we want to change that. We don't think you should have to choose between your wallet and your health as well. You need to take care of yourself. So one of the things we do is scour the planet for the best plans possible and available, because there's no cookie cutter, one size fits all solution. So that's why we have a team of consultants to listen and find out what each agent and their household's needs are. So we can take that information and go, okay, we think you need to go over here to these plans. These have a better framework of delivering services at cost savings to you. So yeah, we see that on average, the Exp agents who enroll in one of the plans save on average $8,000 a year in premiums, which is really big. Yeah, it's really big. In addition to that, we have about 85% of Exp agents enroll in what we call the Clearwater plans. They're innovative and unique, and we've pioneered them, and we don't see any other national brokerages doing anything like this. About 85% of the Exp agents enroll in those. Those are the biggest cost savings. They also give you access to the broadest network of doctors. When you are really needing your healthcare plan to deliver for you, like with an emergency or heart attack, or you get a diagnosis, you need a procedure, that's where the expenses go off the rails. And on the Clearwater plans, we don't have a network. It's completely open. So you don't have that problem of, oh, it's not a network. That's going to be $1 gazillion.
Yeah. So I know that's a big problem with a lot of insurance. Yeah. It's like, oh, you can't go there. You can't go there. You can't go there. You're dictated where you're going. And that's a big problem. You can't go to your doctor that you've been going to for a long time, or someone else referred you to this great person. Oh, you can't go there. They're at a network, or it's going to cost you 4 times the amount to go to someone that you want. So that's a major point. I also like the point that you made about agents getting part-time jobs just to get benefits. I mean, I'm sure that exists at a high level, and you're doing a job strictly to get the insurance, and you don't need to do that. That's a major point that I never thought of.
Yeah, it's common because Americans are used to doing whatever it takes to take care of themselves and their families, and it's hard, it's complicated. Another thing I'll share with you is that the agents, whenever I'm presenting an overview of the plans, I'll ask the agents to give me one adjective. I always have to guard them and say, keep it clean. One adjective to describe the experience of researching healthcare plans. And it's consistently a terrible list of adjectives. It's confusing, overwhelming, miserable, painful, torture. What other words can I think of? Nobody's ever said, great, it's pleasant.
Yeah. Well, I think to that point, and why that exists is, even if you usually get a consult somewhere, they're like, oh, this is a good plan for you. It's this much of a deductible, and this is what it's going to cost you a month. And that's about all you know. You don't really know like what you're getting. Like, it's so hard to know what the meat of the insurance is. So I like the idea that it's connected to EXP. They're standing behind it. So if it got out that it wasn't good, or it was poor plans, or, it was, it's cheap or less expensive, but the plans aren't good, that's going to get out, and that's going to travel fast. And that's not happening. It's the complete opposite.
Right.
So obviously you guys are doing a great job at having clarity of what people are taking part in as far as their program.
One thing I wanted to mention, hey, Margo, is I used to sell insurance, not health insurance, but I know how important it is for you to be an independent. In other words, to be able to shop different companies, because this is not all one fits all and we'll just grab from one company. What you have is multiple companies. Is that correct?
That's a really good point. So we are true brokers. We are working for EXP agents, not any of the carriers. So our commitment is to getting the agents the best care, whether that's through plan A, plan B, plan C, doesn't matter to us. So yes, absolutely, because we aren't captive is the word.
Right.
Meaning we're stuck selling one type of plan or one carrier's plans. No one size fits all works. And also none of them are perfect. And there are challenges with every plan. So I don't want to represent that it's, all rainbows and, unicorns all the time. And I think one of the things to note about that, building on your point, Kathy, is that nobody's going to be able to represent you. You're going to get the best perfect plan all the time, and nothing's ever going to go wrong. Something's going to go wrong occasionally. Right. It's a matter of how does that company deal with it. And so having the teams that we've got behind us to go to bat for agents is par none. I don't know of anything else out there like that. I'll give you an example of something we've seen lately, and see things change and trends develop, and providers are constantly searching for new ways to reclaim lost revenues. And so then that'll present itself in like, oh, a screening colonoscopy is considered in network and therefore $0, but I'm going to code this a diagnostic colonoscopy because I, the provider, get to earn more money from that. I'm also going to charge extra for people in the room, things like that. And we've had to get involved and go to bat for the agents to make sure that the providers and the carriers, that all of those things are untangled, and to protect the agents. So I think I just want to point out that's one of the things.
That's a big deal right there.
I know.
That's huge. To have somebody fight for me when I don't know how to fight.
Right.
But you know how to fight. I need that. Yeah, that's great.
Hey, Margo, I know I've heard you talk a number of times. And one of the things you talk about that the plans that Clearwater has is a second opinion. And I know that's very close to your heart as well.
Wow.
Hope I'm not putting you on the spot. Would you share a little bit about the importance of that second opinion.
I am delighted to share. I feel like it is on my heart to share because I know now from my own personal experience. I did not know before. I think most of us rock along thinking, I'm healthy, I take care of myself, pretty much nothing's going to happen bad to me. And it's kind of like the phenomenon of everybody thinks that they're an above average driver, which can't possibly be true statistically. None of us think bad things are going to happen. It's good to be positive. It's also good to be prepared. So I'm one of those people that thought, I'm not really a candidate for anything. Big stuff things run in my family, but nothing like, no cancer runs in my family. And I do the healthy choice things along the way and have for a while. And be that as it may, at 57, a year ago, I got a cancer diagnosis. And that threw me for a loop. I had no idea. And they were like, the oncologist would say, oh, so did you work in a chemical factory? No, no. Office working, in interfacing with people. No, I don't understand why you're asking me that. Because there are trends in what causes cancer. And then there's just randomness. And the reason I mention that is because it was random for me. I kind of thought I had this arrangement with cancer. I will do the healthcare, healthy lifestyle things over here, and you, cancer, stay away from me.
Yeah.
Cancer didn't actually sign that contract, so that may be where the problem developed. Yeah. So I got this stage 1 diagnosis in January of 2020, and I was a little worried about it, but it was stage 1, and they said we're going to do immunotherapy, and it's not going to be a big deal. So I was more inconvenienced, I felt like, at that time. What I didn't know then, and I do know now, is that 70% of cancer diagnoses are wrong.
What?
That is a staggering number. And we could talk about why that is all day long. I think, let's just say, cancer's super complicated and you can't be a specialist in everything. So what I found was I'd gone to a highly reputable, highly loved and respected doctor here, but he wasn't a specialist in the kind of cancer I had. So I got the second opinion, not because I knew or was so smart about it, but because it came free with my plan. And I thought, well, I may as well. So I got the second opinion, and I was one of the people I was one of the 70%. It was an incomplete diagnosis. I did have that one kind of cancer. I had, in the same place, this was bladder cancer, which is not typical for women most of the time. I had a second kind of cancer in the same place that was completely missed by the first pathologist and the first doctors. Mind you, they were looking at exactly the same reports, the slides of the pathology reports, everything. They were looking at the same data. But MD Anderson saw something that my local doctors missed, and that second opinion saved my life. Because if I'd not gotten the second opinion, we would have treated cancer variety number 1 with immunotherapy, and that would have worked. But it would have not been treating the not known at the time second kind of cancer, which of course was 100% fatal and 100% recurring. So wow. I wouldn't even be here to tell this story if I hadn't gotten that second opinion. And I didn't know enough to get the second opinion. I think most of us don't. So it's one of the things I feel strongly about sharing with people, no matter what plan you're on, when you get a diagnosis, always get a second opinion. And if you have a plan that doesn't pay for it, that's fine. Negotiate with doctors and say, I'm self-pay, my insurance plan won't cover this. What is your self-pay rate? I want a second opinion. It's too important. So that's a really, and second opinion is built into the Clearwater plans. It doesn't cost anything to use.
Awesome.
Amazing.
How about like prescription plans and things like that?
I love that question because we as consumers of healthcare and health insurance only know a few things to ask, right? Because we just don't know. So we ask, I need a good drug plan. How much is that? And what the Clearwater team does, the consultants will drill down a little bit and say, great, tell me what medications your family is taking. And the reason we do that is because a good portion of the time, GoodRx discounts will beat drug plan prices. So why pay extra for a souped up drug plan that is not even helping you? So that's an example of, no, we don't make any money on selling GoodRx. This is not even a business model. It's just free to everybody, and everybody should download that app, by the way. It takes about a minute to pull up. It's really easy. And what I've learned, this is anecdotal, but what I've learned is typically for some reason, grocery store pharmacies have the best rates on medications. I don't know why.
Interesting.
And Walmart's not playing. They used to have good prices, and right now they don't. Walgreens is the highest. CVS right behind that. Right now, that could change tomorrow. You don't know, which is why I recommend you check it. Even if you have something you fill every 90 days, it will vary. It's like the stock market. It's weird. So just getting used to how much variety there is in the pricing of medications and even in the delivery of services is crazy. But this is part of the mind-opening exercise I want to share with people, is think of it now as something you consume and be an advocate for yourself. Here are some tools.
Yeah. I mean, as we continue to talk, I see the more and more value in your team, and your team.
Right.
It's like a voice in between the insurance company and us, to help educate us and maybe lead us right down the right path. Right. And I'll say it again, if you guys weren't doing that, it would get out, because there's a lot of people on these plans in EXP and benefiting, and if they weren't benefiting, it would be well known.
Right.
So you guys are obviously doing something great. Talk to us a little bit about deductibles. Is there benefit to higher or lower, or how does that work at Clearwater?
Right. Another good question. That's another thing we're all aware of. Deductibles do not go down. They seem to only go up. So if you're on a traditional insurance plan like Blue Cross or United Healthcare, one of those, there's a toggle between the amount of the deductible and the amount of your monthly, and that's the same across all plans. Right now, the deductibles can be $8,100 for an individual, $16,000 or more for a family, which is crazy money. It feels like you're just not insured. And people just end up not using it because it's completely catastrophic at that rate, at that point. And then you still are exposed for out-of-pocket expenses if you end up using providers and hospitals who are out of network. There's a million horror stories that I'm sure you guys have heard, I personally heard, and that's one of the things that we want to avoid. So we really have two different categories of plans in our tool bucket, our tool belt. So one is traditional major medical health insurance, and that is a good fit for about 10% of the people that we talk to. If there's ongoing, fairly expensive or intensive medical needs being, they're underway right now, that's probably going to be the better route, and we will strategize with people to find the right plan, because those aren't all equal. For the 85% who prefer one of the, we call them Clearwater plans because there are unique things, but they're available for agents, and we're not the carrier. So we have different carriers, and those plans, which are a combination of health insurance that we use for preventative, so day-to-day, like it's got unlimited telehealth. My husband just used it last night. It's great. He got a more detailed and helpful diagnosis over the phone with a doctor than he did talking to the nurse practitioner of his actual doctor, because you're talking to a doctor. They have several years more experience in school and in working. That really blew my mind. Secondly, and so also for preventative, so your annual exams, your well woman exams, screening colonoscopies, children's immunizations and well checks, those in network, like any other plan, are $0 out of pocket. So that's the same across really all the plans. What's really different is when we get to the deductible, that is where the rubber hits the road, because if you go to the ER, you're going to pay, you have a choice. You can choose $5,000, $2,500, or $1,000. Those are the deductible amounts, and they are tied to needs, which I really like, because that's how we experience the need for healthcare. It's more around when something happens. I'd rather the amount that I pay out of pocket be geared towards when something happens. So let's take an ER visit, for example. Let's say you've got a kid who plays soccer and they, I don't know, tear a meniscus or something. So that's a trip to the hospital. You're going to get to the most popular deductible choice is $2,500. So you'll pay the first $2,500 out of pocket like you would on an insurance plan. And then the community in medical cost sharing will pay the rest of the bills, which is great because you don't need to be the bank and you don't need to wrestle with providers. And what I love about that is you're not limited to where you can go. So you don't have the gotchas of, oh, I accidentally went to a hospital that's no longer in network, and now I'm on the hook for $25,000 or worse. Yeah. So you're limited to in that need to $2,500. That's great because even if there's like surgery or something further down the road that has to do with that need, you don't pay the $2,500 again. So let's say January 3rd, kid gets injured, tears this meniscus in this example, they have surgery. And then in July, they have another complication due to the surgery. That's not another $2,500. It's the same need. You don't pay it again. So if then that same kid were to, this is, using kind of worst case scenario, were to have a cancer diagnosis, that would be a separate need. And then they would pay, the family would pay $2,500 for that one as well. And then there's a maximum of 3. So the worst case scenario would be 3 different needs, $7,500 for the family. And another thing about that I like is that the complications or further treatment tied to the needs, what's the best way to explain this? If they had a need in July, and then they had a complication in February the following year, it's tied to 12 months around the need, not the calendar year. That makes a big difference because you don't have the same sort of motivation to get everything done at the end of the year. Yeah. And you can just get walloped by, well, $8,000 last year, $8,000 this year. It can really add up. So we see some massive savings because of the way that's arranged.
Yeah.
That's awesome. How would like a current EXP agent do you guys do like consults, individual consults for the agents and their families, or
we do
big plans? I mean, how would they get in touch with you all? What's the best way to set that up?
Let me drop a link in the chat.
Okay.
And that's not the chat. Let's go to the actual chat. Here we go. Oh, yeah, Angie is saying it's great to have somebody fighting for you. No kidding. It's hard. And I don't know about you guys, but even if you do have a really great session with one of our consultants, it's informative, you learn a lot, and at the end of it, you make a good decision and you're enrolled in the plan. Are you going to remember 100% of what you learned? I mean, if you're like me, no. Make a good decision. And then I'm like, I feel good about my decision. Don't really remember what I chose. Yeah. And so we have an after you enroll set up. Well, actually, we have a series of welcome emails that say, here's how to use Teladoc. Here's how you start a new need. Here's how you find a doctor and things like that. I wish everyone read those. They don't. So they still have the questions. And we have a concierge team available by chat, phone, and email. And we also have a straight line of communication directly in with the carriers. And so we can go in and our team can go to bat for you behind the scenes as well. And they do.
Great. So, I mean, that was going to be my next question. Like, once they're in the program, is there a spot where they can go to continue asking questions and get direction? And that,
yes.
You answered it.
The answer is yes. Let me give you the link. There is a custom website for EXP agents, and it's right here. And there's 2 things. There's a few things I want to say about that. I want to invite people to use that resource. It is specifically for EXP agents, and people considering EXP agents are allowed to look as well. We don't have pricing on there, and here's why. Because there's literally thousands of combinations. It wouldn't be accurate.
Right.
And I know that's what everybody wants to know.
Sure.
And really the best way to get the most accurate quote and price is to talk to one of our consultants. There is a quote tool that's automatic, like a little AI tool on the website on expagent.healthcare.com. I actually recommend you don't use it. Our team spent a lot of time on it, and I appreciate that, but it only asks about 8 questions, and that is not enough information to give an accurate quote. So it will tend to quote high, and then people go, well, that doesn't help me out, and then they leave.
Yeah.
So I would recommend,
I would
recommend do a consult, and it's not a high pressure thing at all.
Sure.
It isn't. You're not going to be sold.
Yeah, I've heard great things about the consults.
Good.
And leading them down the right path that fits them or their family.
Right.
And also I've heard instances where you guys have said, you know what, you have a plan that's in place that's better than, based on your situation.
Right. And that has also changed in the last few months because, and here's an example of how we stay on top of what's happening. It's always changing. There's nothing as constant as change. In May, all of a sudden, the Biden administration issued a huge discount that is applied to healthcare.gov for income ranges that are much higher than ever. So even $250,000 a year, people can get a discount on some plans. So we had to learn about that, and now we know. So that's new. We will keep that in mind if, as we're helping, that might be the best route because of your needs and the cost and all that. So we just take everything into account as it continues to change and ebb and flow. And what it looks like next year, we have no idea because those discounts are only for the year. Like real estate. Yeah.
It's a moving target. It's never the same. And
sure is. Exactly. So, that's another thing where I think it's great to be able to offer agents a team of subject matter experts who remain up to date on the subject matter. I just say leverage our team. Why would you want to go try to become an expert in this stuff? You just told me it's a terrible subject and it's a miserable experience to try to learn about it. And we stay on top of it for you.
Yeah.
So I wanted to ask you one question. So there's a lot of agents, non-EXP, who would love to have this opportunity. So if I said to a non-EXP agent, could you may be interested in this. It may be a reason why you say, because of the savings that you've got, that maybe you'd be willing to look at some of the other things that EXP had to offer. How does your staff, your consultants, ask them the question, are you an EXP agent? And how do they treat that?
That is an amazing question, Kathy, because we started getting those calls right at the beginning because there's such an interest in EXP and the model, and healthcare is such a problem for agents. So we right away trained the staff to handle those inquiries like the incredible opportunities they are for EXP and for us. And so the same level of professionalism and care is given to those people. If you go fill out, if you click on that link that I posted, you'll get a Calendly landing page. And if you pick a time when you complete that little form, it'll say, it'll ask you questions, and that's where we'll uncover that they're considering it. And so we always know, if that's something, and it's great because we've actually seen and heard people, we've had people cry because they're so relieved. We've had people say that I'm joining right now. As a matter of fact, my next call is going to be join. And our team has received gift cards from people who are, that's amazing. And what other kind of business is there where you get those kinds of responses?
I could see if you're saving someone an average of $8,000 and then they don't have to pay franchise fees on top of that, they're basically here for free. They're doing their business here for free in many cases.
Right.
So it's just a matter of getting the word out. And that's the tip of the iceberg. There's all these other great benefits that come with the company as well. So we're excited about this.
What triggered it for me, I was on a Zoom call with an EXP agent, and she was talking about the health insurance, and she said, I saved $1,000 a month and got better coverage. And she's probably in her 50s. And I'm thinking, wow, there's $12,000 right there of the cap is exactly how I saw it.
Exactly. Yeah, that's our favorite kind of response. We know of people, like, for example, and states vary in their cost. California is shockingly, one of the most expensive. So we know of families that are saving literally $24,000 a year, which is insane. Is that what everybody's saving? No. I mean, some people save $300 a month, and that's great. Anything is welcome, but the average is 8,000. It's half the cap. It's crazy.
Yeah, that's amazing. Thanks.
So if we were to set someone up that was not with the company, we would give them that link that you put
link,
and get set up, and that would be a good once we know what they picked, would be a good reason to follow up with them as an agent to see how the call went and what they're saving.
Absolutely.
I actually have an agent that I talked to a couple years back about EXP, and she has her own firm, so she didn't see the savings with the 16,000. She saw it as an expense. But I put a post out there: if there were a way that you could save some money on your health insurance, would you be interested? And it had nothing to do with EXP. And I had 2 agents reach out to me because there are so many. I went without health insurance when I first got in this business for 7 years.
Everybody's been there at some point, unless they had a spouse. I was that person too.
Yeah. So it's an important piece. I'm grateful that we have here at EXP. I don't need it at this stage, but it's perfect to be able to have it. Although I do want to have a question. So I am over 65 and I have a supplemental with mine that I don't pay for. Do you have plans for over 65?
Great question. One of the things we've learned, we have supplemental plans for Medicare. Medicare, is that right? Medicare is for over 65, right? Okay. We do have Medicare supplements available, and we do help people sort through which things are the best ones for them to choose. We don't have other plans for people over 65. Here's why. No one can compete with Medicare, so there's no reason to.
Oh yeah, well, I'll take the Medicare all day long. But the supplemental, I was curious about. I assumed I didn't have an option. See,
you do.
There. How about that?
Yeah, I know, exactly. So just, we ask people to put that in the form, the little form that they fill out, and we'll get right on it. So
great.
Yeah. We've also got, I wanted to mention dental and vision. We have life insurance. That's amazing. And coming soon to a consultant near you is disability, which is just unheard of in, real estate and for self-employed people. Excited about that. And some other things I can't really tell you about just yet, but they're pretty exciting.
Yeah.
Wow.
That's great.
That's
I did not know that.
Okay.
But that's all I had. And that was some great insight. Is there
Yes.
anything we left out that comes to mind to you?
There's so much. Oh, you know what I wanted to do? I wanted to share another couple of links. One is the workplace group. So we've got a workplace group, and I found, agents have their different ways they like to communicate. There's your people who are all workplace all the time. And then your people who are like, I never go there unless I have to, text me. So I'm going to give you the different ways you can stay in touch with us. But that workplace group is great for being, just having your finger on the pulse of what's the latest thing. So you can it's free to join. We post things there all the time. And then another thing I wanted to share is, and Kathy, I told you about this when we spoke on the phone recently, the Agent Attraction Toolkit. So now shifting the conversation more towards how do you leverage this amazing set of benefits to attract agents who are struggling with healthcare. We've created this healthcare toolkit, and in it actually just goes to a Google Drive right now, and it has folders. And in the folders, you can choose slides that we've crafted, which you can customize and brand yourself. We have, what else do we have in there? Slides, flyers, we have videos. All of the videos in there are EXP only, agents talking about their plans. We have loads of videos in there, just added a whole bucket of new ones recently. One is an agent, Chris Stone, who joined because of the healthcare. That was what did the, tipped the hand over to EXP for him. All the other benefits were like, well, done. This is just, it's a no-brainer. Also in there are social media posts. So Kathy, you don't even have to create your own next time. You can just grab one of those. And there are even campaigns in there that you can customize and make your own. And we are open to coming and doing a training on how to use these tools and the messaging to attract agents to learn more. That is something that's available to you as well.
Awesome.
And what is the other thing I wanted to share about agent attraction? And we are available to be a guest speaker at attraction events, either virtual or in person, if the scheduling and all of that allows. So we really want to be an extension of your attraction team and strategy.
Fantastic. We might definitely take you
Yeah.
up on that at some point.
Yeah.
Good. This was amazing. Thank you so much for your insight and taking the time to come on. I'm sure our group will eat it up, and you'll probably get in a lot of calls and contacts for you and your team. So thank you so much again. And I'm sure we'll see you soon.
Yes, you will. You know what? I meant to answer a question you asked how to find me. I'm on Workplace, so you can find me there if you have questions. So I very much looking forward to keeping the conversation going and working with you guys to continue to help change lives. It's a pretty amazing thing that we get to do.
Yeah, it's fun. Thank you so much.
Thank you.
Thank you. Bye.
Take care. Bye-bye.
I can't copy those links over because